Hi, I'm Emma, and today I will be addressing the age-old food insecurity. This insecurity is the food desert, which is food insecurity. The USDA defines food deserts as part of the country vapid of fresh fruit, vegetables, and other healthful whole foods, usually found in impoverished areas largely due to a lack of grocery stores, farmers markets, and healthy food providers. Urban sprawl and suburban living has resulted in a change in where the majority of biogravity is, far from city centers. This means a change in healthy food providers' locations are replaced with fast food and convenience stores. Midlife and elderly individuals often do not have the sufficient nutrient intake recommended. Transportation, accessibility, physical restrictions, fixed income, and cost are the primary limitations that midlife and elderly people face when trying to access food, especially within food deserts, putting them at a health disadvantage. It is estimated that by 1988, some 65% of all new supermarkets were built on edge-of-town sites, according to the National Consumer Council. The other 35% were supermarkets within town that come with physical and social barriers that deter midlife and elderly customers. Only 79% of the population 70 and older have driver's license. This percent makes up 11% of the overall driver population. A report by the Gerontology Data Service, GDS, with Age Concern England, from 1996 highlighted the fact that 27% of people aged 70 to 79 in Great Britain found it impossible to do their own shopping. The same report identified that 50% of men and 32% of women in this age group did not have access to a car, and a third of people over 70 of the age had difficulties using public transit. Many elderly people with driver's license do not own or have access to vehicles or choose not to drive due to their lowered senses. Additionally, many elderly and aging people are forced to use public transportation or rely on family members for transportation or food provision. In a study of 112 people ages 60 years and older, only 66 claim to do their own grocery shopping. I should note, all of these graphs that are shown in my presentation today are made by me. In the same study of 112 people, of the 38 who did not do their own grocery shopping, 16 did not know where their food was purchased, 35 stated they did not request their shopper to visit a certain store, and 33 of the 38 stated they had moderate to complete control over the foods that were purchased for them. That means that 35 of 38 felt that they did not have complete control over foods that were purchased for them, which leads back to food insecurity. This shows that many elderly not only do not have control over the nutrition they are receiving, they also do not know where it comes from. Physical limitations are more common in older age. In 2009, 38.4% of adults 65 years and older reported physical limitations. These limitations are, but not limited to, difficulty in stooping, lifting, reaching, grasping, or walking. Difficulty accessing food may negatively affect the nutritional status and health incomes, especially in older adults. Food insecurity was previously reported to be associated with functional impairments of U.S. older adults. The prevalence of food insecurity was 7.9 among U.S. households with elderly individuals in 2010. Accessing food is a complex process requiring a location to access food, adequate financial and transportation resources, and the cognitive ability to plan and carry out accessing food. Also, according to Huang in the Journal of Aging Research 2012, 60.8% of community dwelling adults ages 65 years and older in 2010 reported difficulty with at least one basic action: movement, emotional, sensory, or cognitive. Entry and accessibility to retail and grocery stores was one of the leading factors to whether or not midlife and elderly people visited, Huang determined. Food access destinations should also take into account the needs of this population, especially the need for adequate space and ease of entry when using an assistive device such as a walker, wheelchair, or motorized chair. Urban planning should particularly consider proximity of food access destinations to other destinations with goods and services, such as a cafe or library, as this may help older adults continue to live independently in the community. Facilitators with an automatic door, lightweight doors, entries that were conveniently located, flat at street level, were preferred by the midlife and aging. Barriers with heavy doors, doors that opened outwards, two sets of doors, raised thresholds, doormats, poorly located entries, and the presence of stairs or ramps were unfavorable. Accessing food becomes more difficult with older age and having mobility disabilities due to numerous barriers, such as restroom accessibility, bulky displays in aisles, changes in product layout, signage, location changes, elevators or escalators, aisle width, customer density, inattentive fellow customers, etc. At restaurants, closely spaced tables and chairs can become a barrier too. Obstructed aisles and other shoppers' carts were commonly reported barriers as well. Employee-customer interaction is an important factor for aging customers. These factors can include, but are not limited to, shuttle service drivers, store-to-vehicle grocery carriers, store employees and staff, table service at restaurants, and volunteers. A major theme was quality and service given by food, destination staff, and employees. Good service was a facilitator reported by many participants in the Journal of Aging Research. Examples of good service included assistance with bringing groceries to a participant's vehicle, reaching items on high shelves, and opening doors. For the elderly, it is very hard to carry food and find a place to sit, so waiters and table service is very important. Despite a limited amount of mobility, it is still important for the aging and elderly to have a level of control over where they shop and what they buy. Research question. Where are the midlife and elderly people most at risk for food insecurity? First, I'll show you my vulnerability model. This data was collected for the ACS block group, and I am targeting people 85 and up, and all people 65 and up that are still in self-care, meaning that they do not receive help from outside sources. From my vulnerability model, I got this vulnerability map. It shows where midlife and elderly people are densely populated in red. In comparison, where they are sparsely populated, they are in blue. It can be observed that many elderly are densely populated around the south end of the river curve. Here is my access model. The top two factors are walking distance. This takes into account barriers such as rivers or buildings when calculating distance. The top factor is big retail stores. I have this at a half mile. My second is small and convenience stores at a quarter-mile walking distance. I have small and convenience stores at a smaller walking distance because since there are less options at small stores, the demand and willingness to walk would also decrease. Below that, I have calculated the total percent of the population that do not own cars, as many of the elderly, especially in the city, may not own or have access to cars, as I mentioned before. Next are my vulnerability factors, all individuals 85 and up, and people 65 and up in self-care. The next is calculating the percent of the population of people within poverty. I have this because fixed income and low income are typical for many elderly people, especially those that fall into food insecurity. Lastly, I have taken public transit into account. Public transit can be an access point to grocery stores or similar for individuals in a food desert or have food insecurity. Here's my access map, the result of my access model. The access map shows the ease of access midlife and elderly people have to accessing large retail and grocery stores. Red signifies low access, and green signifies high access potential. As you can see, in the northwestern sector, there is much more access availability, while in the southeastern area, there is far less, being very red. Buffer distance. Buffer distance is the exact radius from a center point. The center points here are big retail stores in purple and small and convenience stores in red. This buffer map shows the quarter-mile radius around corner stores and convenience stores and a half-mile radius around big retail stores. Buffer does not take into account any environmental barriers, such as rivers or buildings. In comparison, here is my walking distance map. This does take into consideration environmental barriers. See how there is a difference. Here are my results. This map shows where the two previous maps overlap. As you can see, the overlap is very low and primarily concentrated horizontally along the center of the map. Here I have overlaid both the access and vulnerability maps. In both cases, red signified potential for food insecurity. Based on all my findings, the areas in red, mostly on the top and bottom of the map, are neighborhoods at risk for food insecurity, if not already a food desert for the aging and elderly. Identifying food deserts and insecurity for the aging and elderly is a multifaceted problem that needs to be addressed on many levels. Addressing food insecurity for the midlife and aging consumer population within the Twin Cities will require work on many levels. Here are some examples of ways the industry and city can combat food insecurity.